Hey YouTube, my name is Hunter Moore. I'm a student at the University of North Texas. I'm going to try to make this video shorter because the last ones have been too long. I wanted to talk to you a little bit today about the Freebirthing movement and how it kind of ties into the business of being born and how that documentary is just a little bit slanted. One thing that I personally believe is that people should, when they're making a difficult or important life decision, they should be opened up to all the information, broad spectrum, test results, data, statistics, and that data should be unbiasedly presented to the public. Unfortunately, we don't get that as much nowadays, such as Fox News and honestly a lot of documentaries that are created by people such as Michael Moore or even Ricky Lake, who we're about to talk about. Ricky Lake is the head of My Best Birth. She started the company back in the 2000s to educate people on home birth, but also she advocates the free birthing movement. Free birth is a movement that started about a decade ago that advocated for a do-it-yourself birth. It's a very dangerous birthing technique. Not many medical professionals ask their patients or tell their patients to seek it out. It involves no medical professionals whatsoever, and so it's very dangerous. You have your baby at home with either yourself giving birth by yourself or having a partner assist you, such as your husband or boyfriend. No medical professionals. Very dangerous. You don't have a way to monitor yourself during the birthing process unless you've bought materials and you are a medical professional yourself, which most of them are not. So, a couple of things about the business of being born. The business of being born was developed in 2008. It came out in 2008, and it was produced by Abby Epstein and directed by Abby Epstein, and it starred Ricky Lake, who is a home birth advocate, but she is not a home birth or birth, period, expert. She is an actress, and she interviews multiple people on the documentary who are actors and actresses as well. And I want to talk about the slanted information that she uses, or completely false information that she uses in the documentary. And that's a real risk for some people to use. I mean, why would you? This is a little bit embarrassing for her. It kind of hurts her ethos a lot. Ellen Vital McAllister, who comes in to the discussion in the documentary about physicians, she gives this quote about physicians and obstetric professionals. The obstetric professionals, should be doing childbirth surgery all day, every day when needed. They should not be doing normal births because they're not trained in it. They have no idea how to do it. I wasn't exactly in a place to make an assertion on that, even though I know it's not true. But I went ahead and called a assistant professor at the University of Texas Southwestern Medical School, which is the best medical school in Texas. That's where I am right now. And he had this to say, quote unquote, the assertion that OB-GYNs are not trained in vaginal birth procedures is ridiculous. That is a bit ludicrous. Why would they give OB-GYNs a license to deliver babies vaginally if we're not trained first? I'm an assistant professor at the University of Texas Southwestern Medical School, and I can assure you that we properly train residents to perform a vaginal birth in the most detailed ways before sending them out into the field. I've seen that documentary, and to be perfectly honest, it's comprised of people who have no prior medical training to the degree of an MD. That's pretty powerful. Why Ricky Lake would allow that, unbelievable amount of false information to come out on her documentary is a little bit shocking. Another misrepresentation of data that they have is when Ricky Lake comes on and she says that more babies die in the hospital than they do at home. And that is completely true. I'm not saying that that's not true. However, the data is a little bit slanted. 4.25 million babies were born. This is from a report done by the CDC. And 4.25 million babies were born in the hospital, and 2,606 babies passed away from the time of birth to 27 days. Home birth saw 23,476 births and the death of 27 infants from birth to 27 days. Now, the problem with that is that, for the 4.25 million babies that were born in a hospital, the ratio of birth to death from 0 to 27 days is 0.61%. Now, if you look at the home birth mortality rate from 0 to 27 days, it is 1.15%, so almost double. So at home, you're going to have 1, maybe 2 in a mathematical anomaly. If an emergency situation, you're going to have 1 out of every 100 babies die. That's pretty big. That's a pretty big statistic, and it's a large risk. That's 1 out of 100. It's kind of, it's too big of a risk for me. I would want to be in the place where less than a baby dies. And another thing that you have to take into account is the 4.25 million babies that were born in the hospital. The CDC in the report doesn't go over which were high-risk pregnancies and which were not. Very little high-risk pregnancies and births happen at home. Very, very little. Where at the hospital, many of them do. All hospitals pretty much have a NICU. They're going to take care of sick babies. They're going to have sick babies that are born. So, that information, that ratio, the number of babies born in the hospital and dying compared to the number of babies born at home and dying, the ratio is what they should be looking at. They look at total numbers, which is false. And for 4.25 million babies to be born in the hospital and only 2,606 babies dying, that's pretty good. That's a pretty good record. Whereas, 23,476 births at home, and you actually have an okay large statistic. It's still pretty small, but it's still a whole percent. It's not a 0.5%. So you got to look at it. So why do people free birth? Cost. That's really one of the biggest reasons. And, a cesarean section, if something goes wrong, in 2009 costed $21,000. And a vaginal birth without any assistance medically was $9,617 in 2009. So, a lot of people have insurance, but 16.3% of Americans don't have health insurance. And that's in 2011. But also in 2011, the average cost for an insurance premium per month was $414. And for a young couple who are low risk and have less money, that's a turn on for free birth. It's cheap. You don't have to pay anything. You don't have to pay a midwife to come out and help you with the birth. They're going to charge you money. And a lot of the times, insurance deny people who have home births because it's against medical advice. So with the rise of cost and you kind of have to cross your fingers and hope that the insurance is either going to pay it all or they're going to pay a whole huge chunk of it. So, that's a big draw. And with the rise of traumatic births and wanting to be having comfort while you're giving birth, a lot of women like to do it in their home. You know where your kitchen is. You know where your bedroom is. You've been in the same bed for God knows how long, on the same mattress for God knows how long. Instead of being in a white hospital room with white walls, white tile, sanitary this, sanitary that, kind of smells like a madhouse. It could drive you crazy, especially if you're having labor for 20 hours, which is what my mom went through. They do it for comfort. So what do we do as far as the medical facilities go? Well, on the business of being born, there is a Dr. Jacques Moritz, and what he has done is he has built a more stable and comforting environment, such as a home birth environment, which in a home birth you'll have carpet and you'll have a bed that's large and has a frame, and you'll have a bathroom that has a toilet and a large walk-in shower And a lot of women like to labor in there on a birthing ball and have water flowing down their back because it relieves back labor. And they have a large tub in case they want to try a water birth. So, you know, they have all these alternatives to a dorsal recumbent position. And a lot of women like that. They like alternatives. And so to make these readily available, I think would make the birthing center type room more available to women at a hospital. It's going to decrease our risk for infant mortality, but it's also going to bring women back and try more at the hospital. You know, and it might stimulate our economy a little bit better if we have more women at the hospital. You know, that gives doctors more pay, and especially when the government is cutting Medicare, Medicaid, we're going to get less pay for those doctors. But the more people we get there, you're going to still have the demand for doctors that you still do, and the demand for male doctors right now is going down in obstetrics. So you know, you want to keep people flowing in, showing them that yeah, there is something there for you. So all in all, we all have the right to do what we want with our own bodies. That's just how it goes. It's our American right. If you don't like it, then it's too bad. But you have to, you know, you have to respect your body. It's a temple. And I believe that every life is sacred and should be protected. So, you know, for all of you looking for options for home birth, look into the information. Don't just take it at face value, especially documentaries that are widely revered as, you know, polarizing, you know, icons for the movement. I strongly encourage you to go look at some of the data that I was looking at, and you know, just research what you're wanting to do, because it all has to do with your safety. All right, guys, I am out. It is the afternoon. I am going to go out and see a couple of my friends, and good luck to all of you who are having a baby. I wish you the best of luck and hope that is a beautiful process for you, and hope that you enjoy your newfound love. Okay, have a good one.